I think the big story, which I'm sure you've heard a lot about, is the breakthrough on microbicides. It's a game changer. And we're going to have to learn on the behavioral side how to take advantage, do a better job of doing combination therapy. One of the findings from the trial is that women who adhered better to using the microbicides had better protection. And so the issue is now, how can we support at-risk people in terms of using microbicides? And I feel inspired by the breakthrough on microbicides. I feel very inspired by the good work that I'm seeing on all parts of the world. I'm feeling very inspired by looking at the community work that's going on and the community building work and community development work that's going on that will allow us to do better work in the fight against HIV, particularly with marginalized populations and especially among injection drug users. So what this means is we've got this interesting interconnection of psychosocial epidemics that are in turn driving an infectious disease epidemic. One of them is that the big explanations for poor health among gay men are that homophobia causes poor health in men. Well, that's probably true, but we started thinking about that and realized that if homophobia were a culture-wide phenomenon, then it affects everybody, including children. And started thinking about the effects of homophobic attacks on young men as they are coming of age for being different, and how that would affect their development as men and their health in manhood. This isn't just a gay thing. If you raise young children and teach them on a daily basis that their life on this earth is a waste of oxygen, and you raise them with a lot of violence, human beings under those conditions do not thrive in adulthood. And so there are many, many marginalized populations at this conference with lots of HIV, vulnerability to HIV. One of the principles of HIV prevention is that you can expect greater HIV vulnerability in marginalized groups. And so coming up with a theory to explain this allows us to start thinking about interventions to help keeping that from happening. What we're doing now is we're looking at lifetime trajectories of drug abuse among men in a very long cohort study, the multi-center AIDS cohort study. And we've added questions. These are mostly gay men, and we've added questions looking at their experiences in childhood and being able to explain syndemic production among men across the life course. And lo and behold, you know, the data are really behaving according to the theory. So we've done a direct test of the theory, and it's looking like it's whether well supported by data from a long-term cohort study. And it seems to me that from the point of view of interventions, we'd want to look more carefully at the men who are naturally doing what our interventions want to support, and looking at the strategies for success and the strengths that occur naturally among gay men, and try to understand those strengths so that those lessons learned could maybe be transferred to the men who are having a harder time with their substance use careers.